So I'm going to talk a little bit about the symptoms of Chiari malformation. And I know a lot of you have symptoms. Some of you have family members who have symptoms. And I'm going to see a lot of going, oh yeah, I know that symptom. I've had that. If anybody wants to contribute or wants to stop me and ask a question, please feel free to do so. I want to make this as interactive as we can. A couple of objectives. I'm going to list the most common symptoms that we see in this disorder. Explain the symptom. We're going to talk a little bit about what that symptom feels like, or at least how it's reported to us. And then explore other causes, because just because you have Chiari doesn't mean you can't have headaches of another nature, or doesn't mean you can't have dizziness from Meniere's disease or some other disorder that is causing that symptom. This is a study that Dr. Oro and I published in 2004. We did a prospective analysis of 265 patients that we saw back in our office in Missouri. These are all patients who were diagnosed with Chiari 1. They were all adults. This is taken from the self-reported symptom list. If all of you have gone to the office, you know that you have to fill out form after form after form. And some of that really helps us understand the symptoms as you describe them. You're the only one who feels that symptom. The age range from this group was 12 to 78 years, so it's quite a broad age range. Okay, we did see some children back then. We do not see children in our office here. And it's about 221 female and 44 males. The ratio in the literature and throughout the country is about 4 females to 1 male. So it's really strongly, predominantly female group. The overall #1 symptom that people present with is headache. Okay, 98% of the people in this population that we studied, as well as in the general population literature throughout the country and internationally, present with headache. Doesn't mean you can't have Chiari and not have headache, and we'll talk about that in a little while. It is the #1 symptom of Chiari malformation. People typically describe the pain at the skull base or the back of the head. It hurts right here. This is where it hurts all the time. It can go forward, it can go up to the top, but typically say it's right here where it hurts the most. It can spread behind the eyes and throughout the head. You can have a headache that starts here, goes forward, and then it hurts really bad right here. So it doesn't have to stay just in the back of the head. It can travel throughout the head diffusely. The headache can last from hours to days. It can start intermittently. Some people say, you know what, I used to have headaches that came and went. I'd have a headache maybe once or twice a month. Now I have headaches 2 or 3 times a week. Now I have headaches every day. And now the headaches are constant. They never go away. And that's a typical progression of some of what we hear. It doesn't mean you have to have constant headache, but oftentimes we hear the patients say, you know what, when I was 20, I had headaches on and off, really didn't trouble me that much, but now I have headaches every single day. It never goes away. The headache is typically described as pressure, pounding. I can't sing in the choir anymore because when I sing, I just have this explosive kind of headache. My head just wants to pop off my neck. Those are things that we've heard often enough. It's often worse with coughing, straining, laughing. This is the kid who can't laugh with her friends because it hurts so bad that she just stays home. She's just kind of withdrawn from people around her. It's often worse with looking up or looking down. I can't look at the stars anymore because it hurts so badly to look up at the stars. Or I can't tie my shoe. You know, I have to wear slip-on shoes now because I can't tie my shoes anymore. It hurts so bad to bend over and tie my shoes. Now, is that the only reason you have headaches? What are the other causes of headache of this nature? You can have occipital neuralgia. Anybody heard of occipital neuralgia? Some people have a pain that goes along the occipital nerve that kind of is like a ram's horn, comes from the back of the neck, back of the skull base, and goes around kind of behind the eye. That can be a very troubling pain for some people. Migraine headaches. Migraines are a little bit different. because typical migraines, you have some kind of an aura or a warning that you're getting the headache, and then it progresses to a really bad headache. So that's a little bit different from the typical Chiari type headache, but you can have both. You can have migraine headaches and have Chiari type headaches as well. Tension. How many people have ever had a tension headache? Yeah, lots of people are going, yeah. Tension headaches are not uncommon. You've used the computer for 12 hours, you're working on a paper, you're working on a deadline, you're in your office and your boss is making you do something that you just don't have time to do. Those are tension kind of headaches. And again, that's a little bit different from the typical Chiari headache. Craniocervical pain. People who have degenerative changes in their neck can often have pain that radiates from the neck up into the skull base and into the back of the head. And that can cause a pretty intense headache as well. Medications can sometimes cause rebound type headaches. Not all medications, but some of the headaches that we use even to treat headache can cause headache as a rebound. So if you stop a medication abruptly, sometimes you can have a rebound type of headache. Any questions so far? The second most common symptom is dizziness. 84% of the patients in our study reported dizziness. And this is often described as balance problems. I'm walking into doors. I can't walk past the dining room table without hitting it. Very common. Vertigo, that's when the room is spinning around me. I can't lay in bed because I feel like I'm in an ocean. Okay. The room is spinning is very common. We hear that a lot. And we hear a lot that I can't walk a straight line. If I got pulled over tonight, I'd be in trouble because I can't walk a straight line. And they're going to think I'm intoxicated, but I'm really not. Now, can anything else cause dizziness and vertigo? Sure. Inner ear problems. Anybody heard of Meniere's disease? One of the biggest causes of dizziness and vertigo. So that's another cause of dizziness. Medications. Ever read the bottle of Tylenol? Every medication has side effects. So keep in mind that if you're on at least 3 medications or even 2, probably both of them can cause dizziness and vertigo. So you really need to be cautious of knowing, is this because of what I'm taking in my medication, or is this because of the Chiari malformation? Diet. You know, some people drink a lot of caffeine. I've seen patients who drink 2 and 3 pots of coffee a day. Do you think that's not going to cause dizziness? Okay, that's a really big problem. Vision problems. If you can't see well enough, if you're judging your distance isn't good enough, then you can have serious problems with dizziness and vertigo. All right, difficulty sleeping. 72% of our patients had difficulty sleeping. That's a huge problem for this patient group. Insomnia was reported in 72% of these respondents. It's either I can't get to sleep or I can sleep for an hour and then I'm awake for 2 or 3 hours. I can't stay asleep. My mind just won't turn itself off. Possible sleep apnea. Now, a lot of people confuse insomnia with sleep apnea. Insomnia is I just can't sleep or I can't stay asleep. Sleep apnea means that you can't breathe at night or your oxygen saturation goes down. Very different problems. They can be mixed together, but it is 2 different problems. And for sleep apnea, you really need a formal sleep study. Okay, and that's done in a formal sleep lab. Now, what other causes can you have for the difficulty sleeping? Stress. How many people stay awake at night when they have a deadline to meet? Or if your 16-year-old just took the car keys for the first time, right? That's pretty stressful. Discomfort. I just can't get comfortable. My neck is killing me. I've tried 18 pillows. I've spent $50 on a brand new pillow. I just can't get comfortable. And that we hear a lot because they can't get comfortable because of the neck pain and the headache, and that creates the insomnia. Caffeine, again, you drink coffee after 6 p.m. and you're likely to not sleep very well. So really look at your diet and what you're taking in right before you go to sleep. Some medications can cause difficulty with sleeping. Some can put you to sleep, like Benadryl and the other over-the-counter. They can help you get to sleep, but it may not be a restful sleep. You may not be able to sleep the whole night through. The room is too hot or too cold. That's a really big problem, and you really have to figure that out for yourself. Some people like a really cold room. Some people say, I can't sleep if it's under 70 degrees in there. So you really have to figure that one out for yourself. Too much light. There is a good recommendation that has been made to wear those eye masks at night, and that really shuts down all of the light. It allows your brain to shut down as well. And that can be really helpful for some people who have difficulty with insomnia. Too much noise. How many people like to go to sleep with the television on and sleep with it on all night long? I can't tell you how many times I've come into a patient room and the television is blaring and they're snoring. I don't know how they do it. But really, that is a stimulus that's getting into your brain. All the time you're hearing that noise, that's a stimulus that's getting into your brain. And you really need to shut it down. It really needs to be dark and quiet so your brain can shut down as well. Weakness, numbness, and tingling of the upper extremities. We hear this more often with syrinx than we do with Chiari, but we can hear it with Chiari as well. My arms go to sleep. I can be driving along and all of a sudden I just can't feel my arms or my hands anymore. Weakness in the hands, I'm dropping things. I can't hold a spoonful of soup anymore because I'll spill it all over myself. Difficulty with fine motor tasks is really common, especially those who have high-level Syringomyelia. And that's because your hands, the fine motor function of your hands is just not working quite as well. And that can be trouble with buttoning buttons, handwriting, tying shoelaces, anything that you think you have to use your hands. Typing can be a real problem for some folks. Now, what are some of the other causes of this? Carpal tunnel syndrome is a big cause of those exact kinds of symptoms. And that is a problem with the small nerve that runs into your hand. Arthritis, difficulty holding objects, difficulty typing because your hands hurt. That can be from arthritis. Or neck problems. Degenerative changes in your neck can cause those specific kinds of problems as well. Neck pain is very common. 67% of our patients report neck pain. It's typically from the neck up into the skull base and into the back of the head. My neck hurts right here. It comes up into my head. It's often described as throbbing, pressure, and aching in nature. It's usually worse with bending forward and looking up, just like in Chiari. It's usually worse. I can't tie my shoe because I can't bend over that far to tie my shoes. My neck is killing me. Other causes, cervical arthritis. Certainly as we age, we are all going to face this to some degree over time. The discs in our neck will dry out and the bones will get closer together, which means those joints are closer together. And that can cause severe neck pain. Bulges in the disc of your neck. Again, as we age, we're all going to face this disorder to some degree or another. We know that smoking accelerates those changes. So if you're smoking, now's the time to quit. Neck strain and neck tension. Again, tension can increase the spasticity of the muscles. So you really want to be able to relax that neck. Fatigue. How many people with Chiari have fatigue? I'd say a lot more than 59%, but that's what we found in our study. Daytime sleepiness. I always feel tired. I am always tired. I can sleep 10 hours, get up for an hour, and I want to go back to bed for another 2 hours. So fatigue is just very common with this population. I just want to lay on the couch all day. I don't know how many times I've heard that. I just don't feel like doing anything. I can't play with my kids anymore. I can't participate in sports. I can't go to school. I just don't feel like doing anything. Very, very common. Now, what are the other causes of this? Thyroid problems. I always ask my patients, have you had your thyroid checked? Because that can be a real specific cause of the tiredness and fatigue. Diabetes. Keep that blood sugar under control. If your blood sugar is too high or too low, you can feel really fatigued. Insomnia, we go back to the other problem, and all these problems kind of intertwine. If you think about it, they all kind of intertwine at some point. If you're not sleeping well, how's your day going to go? Not so good. Lack of exercise. I know that if I don't exercise for an hour a day, I feel fatigued the next day. I feel really tired. And even if it's you break it up into 3 or 4 smaller sessions, exercise is going to really help build your stamina. And of course, diet. And I know Kimberly Sexton's going to be talking a little bit about healthy diet, and we harp on people all the time about diet. It's really, really important, and it can be one of the major causes of fatigue. Nausea. 58% of our patients reported nausea. It's frequently reported any time of the day. It's not necessarily associated with I eat this and then I get nauseated, or I wake up in the morning and I feel sick to my stomach. It can be at any time in the day. It's not necessarily associated with vomiting. Okay, so you can have nausea and no vomiting. Alternatively, you can have vomiting and no nausea. So that is very, very common to hear. What other causes can cause that? Gastric reflux. Gastric reflux is very, very prevalent in our society. And a good part of that is because of gluten in the diet. Okay. Ulcers, of course, can cause nausea and vomiting. Medications. Almost every medication on the side effect list will have nausea and vomiting. Almost every single one. So you really need to read the side effects on the medications you're taking. And of course, gluten in the diet. We talk a lot about gluten-free diet. I really, really encourage you to learn about it, to educate yourself about it, because it's become a big problem in this country. Shortness of breath. 57% of our patients reported shortness of breath. It is not necessarily associated with exertion. So it's not necessarily, can you walk up a flight of steps and not get short of breath? It's not necessarily associated with anything that they're doing, but they just feel like they can't take that good deep breath that we need to take. Can't get my breath. It's often worse when lying flat. And we see that probably more with patients who have syrinx than patients who don't. When I lie flat, I just feel like I can't get a deep breath or I can't breathe. Other causes, of course, smoking. And this is your chance to say, yeah, it's a good time to quit, right? Sedentary lifestyle, again, the more exercise you get, the more physically fit you get, the less that symptom may be bothersome to you. Obesity and diet, of course, it's once again, gluten's in your diet. Obesity is a huge risk factor for a lot of other problems as well. And then obviously specific lung problems like COPD, emphysema, chronic bronchitis. Vision changes. Blurred vision, double vision is very, very common in this patient population. Nystagmus means that your eyes twitch. I can't read the newspaper anymore because my eyes just twitch back and forth and I can't focus on that written word. Other causes, cataracts obviously in the older population and even some younger population. Or you need glasses. When was the last time you had your eyes checked? It's really important to have a yearly optometrist or ophthalmologist look in your eyes and make sure that you don't need a new prescription or make sure you're not developing cataracts. And a lot of our patients we send to our ophthalmologist to look at the optic nerve. It's one of the nerves that controls the impulses that go into the eye and the retina and the cornea. We want to make sure that those nerves are okay. So it's really important to have a good ophthalmology exam. Now, is that all the symptoms? No. There are tons of other symptoms. These are the less common. Difficulty swallowing and choking. Every time I sit down to dinner, I have to get a big cup of water because I can't swallow my food without taking 5 or 6 sips of water between. Very common. Back pain, it's typically in the upper back and mid-back. Especially with syrinx. Patients who have syrinx have a lot of problems with back pain. It's typically described as burning kind of pain or aching. Leg pain, numbness, and tingling. Again, that's very common in patients who have Syringomyelia. Thinking and concentration. I don't know how many people I've seen that said, I just can't get the words out. I can't think straight. I'm at my computer at work, and if somebody distracts me, I just can't concentrate. Very, very common with these folks. Speech problems, word finding problems. I know what I want to say, but it comes out all wrong. And my family laughs at me because I can't say the words right. Very, very common. Tinnitus means ringing in the ears. I get this buzzing in my ears. I feel like crickets. I've heard that before. I feel like crickets are in my ears. It must be really annoying. I don't know what that must feel like, but it must be really annoying. And decreased hearing. And that's not just when your wife is trying to tell you to take out the trash. And depression. Of course, if you have some of these symptoms, many of these symptoms, all of these symptoms, depression is going to be very, very common. Any questions so far? All right, so in summary, symptoms can vary from person to person. Just as Dr. Oro said, your Chiari is not her Chiari. Nobody has the same constellation of symptoms. And never, ever compare you to the person at church. They may have really bad headaches, and you say, gosh, you know, I've got 15 millimeter herniation. I don't have headaches hardly at all. It doesn't matter. That's your symptom. So never, ever compare yourself to someone else. The symptoms can be vague. They can kind of come and go, which is why a lot of providers are really confused with this disorder. They're not consistent every day. Doc, I feel this every single day. So sometimes they can come and go. They can be kind of vague. Yeah, I hear this thing in my ear. I don't know what it is. You got ENT looking in your ear. You've got all kinds of people looking in your ear. They don't see anything. Okay, it can be very vague. Not everyone has headaches. I don't know how many people I've seen who have a significant tonsil herniation, and they're really not troubled with headaches. I can remember a lady we saw back in Missouri had, I think it was 32 millimeters. She wasn't really troubled with headaches. She was having vision problems and balance problems. And you want to look at her and say, can't you have headaches too? Because that's really what you should have, right? But not everyone has headaches. The amount of tonsillar herniation does not always correlate with the severity of symptoms. We see some patients who have 5 millimeters and the quality of life is very disrupted. But yet we see people who have 15 millimeters and they're getting on with it.
Why is that used as a tool then to determine?
It's used as a measurement tool to make a diagnosis. But just because you have 5 millimeters doesn't mean you can't have a lot of symptoms.
I guess my question is, to even be seen, I have a certain measurement, despite my severe symptoms.
And maybe Dr. Orr can speak with that as well, but we typically define Chiari as 5 millimeters or more of tonsillar herniation. Symptoms can be intermittent and variable. They don't have to occur every day. They don't have to occur all the time. It can come and go over years. Can begin without any trigger. We do have some patients who say, you know what, I fell off a trampoline and then I started noticing these headaches. Or I got hit in the head with a baseball and then I started noticing things changed. But there doesn't need to necessarily be a trigger for the symptoms. Again, some occur spontaneously. And sometimes it's helpful to keep a diary or a journal of your symptoms. Just to know, okay, for a week I haven't had too much going on, and then I had a little more stress at work, and now I have a little more going on. So it's kind of helpful sometimes for you to keep a journal. It's not all in your head. Okay, keep that in mind. It's not all in your head. It really is in your head, but it's not all in your head. And keep in mind that the symptoms of Chiari reflect the complex nature of this disorder. And we are still learning about it. We're learning from you. We learn from our colleagues. We learn from the research that we're doing. And again, it's a very complex disorder, and we're still trying to understand it. Any questions?